but without any support, you are moving in different directions. So let's just be very careful about it. So we shouldn't walk and reach nowhere because how much does a PRP cost? On average, when you do PRP, patient blood, phlebotomy, procedure, kit, and bill them rupees 5,000-7,000 or 8,000. And we don't even know what we are doing. I've never found anyone telling me in the slide what they have seen. The technician doesn't even know what he's doing. PRP लगा दो. बोलते जैसे घर में बिरयानी बना रहे होते हैं तो PRP लगा दो. When I ask how does the platelet look like, he has never seen the platelet in his own life. How many of you are doing PRP here? I want to ask you. Today I've got a lot of new faces. So Smita, you're doing PRP.
Yes, yes.
तो बेटा बता कभी देखा स्लाइड को?
नहीं, स्लाइड को नहीं देखा. आइडली वी शुड हैव. लेकिन सर अभी मैंने इसमें थोड़ा सा एक ट्विस्ट भी किया. माय हस्बैंड इज अ डर्मेटोलॉजिस्ट, तो
हाँ दे
हमारा ज्यादा यूज था. एंड एक्टिवेशन की जो आप बात कर रहे थे, दैट इज वेरी ट्रू. दैट्स वाई जब तक आप उसको टिश्यू में नहीं इंजेक्ट करोगे वो एक्टिवेट नहीं होगा. सो इट इज फ्यूटाइल टू गिव एन एंडोमेट्रियल पीआरपी लाइक एन आईयूआई इंसेमिनेशन. उसका कोई रोल नहीं है सर.
एग्रीड.
आई
सो
डोंट थिंक सो, क्योंकि उसमें बहुत ज्यादा एक्टिवेशन कुछ होगा ही नहीं, क्योंकि डर्मेटोलॉजिस्ट या ऑर्थोपेडिशियन उसको इंजेक्ट कर रहे होते हैं लाइक फॉलिकल के बेस पे, या आपने कार्टिलेज में डाला तो वहां एक
चल
थ्रोम्बोप्लास्ट
रही
खुद
है
ही
स्मिता.
एक्टिवेट हो.
तो स्मिता का केस डिफरेंट है. स्मिता का केस डिफरेंट है बिकॉज ये लोग तो दे ड्रिंक PRP. They drink PRP.
Not that
Sir,
much, but still.
It's pretty common, madam. So I'm just saying that dermatology, cosmetologists, and orthopedic surgeons, they use a lot of PRP. But for a gynec, I'm asking you, have you ever seen a platelet here? When people come for learning, as
sir,
have you? Yes,
हाँ.
sir,
yes.
I have a question. Sir, we usually inject PRP in ovaries and ultrasound guided. What about endometrium, sir?
Inject. You can do both, madam. You can do. I'll come to this. The PRP when it meets endometrium, no, it get activated per se. So I said sperm when it touches the vagina, जैसे ही sperm vagina को touch करेगा, it becomes capacitated, activated. इसी तरह से platelet will get activated in the endometrium. A change of pH, but the quantity required will be very high. What Smita is saying is right. By injecting is around say 3 ml, but in case we are trying to inject, it will be around 5 to 7 ml because it will leak out also, no? So we'll come to this. So activation is important, but before this, one thing which even she has missed is that to activation is done either it will happen by itself
और बच्चे नहीं आते
by touch.
ऊपर वाले बच्चे
दूसरा
नहीं आते
दूसरा it will be activated by putting some chemical in it. And PRP and platelets are activated by what? Calcium. Calcium will create oscillations. It will break the PRP. Or you can do some sort of mechanical तो करेंगे नहीं हम. We won't put it in a mixer grinder and break it. So we give it a cold shock, thermal shock. So platelets they break. So I'll come to this in some time. And today, fortunately, I have gotten the biggest expert in the country with me, Dr. Surek. He will also speak for around half an hour. I have also called him. He's a master in PRP. In case he's around, he can say hello.
So
So now,
just one more point I wanted to add, maybe it's not the right time. There is something called as GFC. That is that I wanted to highlight because we are using that nowadays. That is an activated version of platelets. I think PRP से ज़्यादा अभी GFC, that is a growth factor consider. I think you will
yes,
be discussing
yeah,
about
yeah.
it.
What I
बट
show you,
गायनाकोलॉजी में उसको नहीं यूज इतना किया है जितना सर डर्मेटोलॉजिस्ट यूज कर रहे थे. दैट्स व्हाई आई वांटेड टू हियर.
you are right.
मतलब
I was coming here ना मैंने आपको एक चीज बोली थी. I think I showed you somewhere that I showed you the factors. I was talking about
या
these. The pure, this is what I'm talking about. They take pure complement. Na? See, for an orthopedic surgeon, he like to take these complements out of this.
या
So depending upon what we do, but we are in a very primitive. हमने कभी platelet देखा ही नहीं. We don't know the platelet count. Normal platelet count नहीं पता gynecologist को. और हम लोग ठका ठक PRP करते रहते हैं. So पढ़ते
यू आर
हैं.
ट्रू सर. आइडली यू शुड. और आपको अपना चेक करना ही चाहिए. मतलब प्लेटलेट काउंट कोई बड़ी चीज नहीं है. वो भी कर लेता है लैब असिस्टेंट, बट देन वी डोंट हैव दैट फोरसाइट टू डू इट.
हाँ हमारा जो करता है वो टेक्नीशियन करता है. टेक्नीशियन तो उसको स्पर्म काउंट कर ले बहुत बड़ी बात है. PRP कहाँ से करने बैठेगा वो बिना देखे हुए करते रहते हैं हम लोग. सो दिस पॉइंट आई लास्ट टू सूर्यकांत बिकॉज he's got many patents on his name. So guys, we are 297 and anyone who wants to say hello to me quickly, we can say hello to each other. Nirmala,
Good
Good
evening, sir.
evening, sir.
Evening,
I am
sir.
here.
Good evening, sir.
Hello, sir.
Pradeep, Dr.
Good evening,
Gupta,
Hello,
big
sir.
boss is there.
Hello,
Dr.
sir.
Gupta, Dr.
Hello.
Gupta,
Good evening, sir.
Good evening, sir. Shivani here.
good evening. Hi.
Good evening, sir.
Good
Jyotsna
evening,
here
sir.
from
Good
Muradabad.
evening.
Good to see you guys. Good to see you guys. Good to
Good
see you
evening,
guys.
sir.
Hello. Hello.
Sir, we'll meet in IFS
Hello,
Delhi.
sir.
Yes. Hi, hi,
Sir,
hi.
good evening. I am also here.
I know, देख रहा हूँ मैं कभी भी देख रहा हूँ. Good to see few boys here, but fantastic. I can see Aruna Kumari, Sangeeta. I'll keep catching you guys. But now coming to glimpses. This is very important for me. Our old memories. In case you're there, spot yourself. Somewhere you'll be able to spot yourself and all our very dear memories. Hi Anita, how are you?
Good evening, sir.
Fantastic, fantastic. You can spot yourself somewhere in these pictures.
Yes, sir.
The way we have grown little way. We are in the 5th year now. I hope you people are getting your gifts. We are sending a
Take
gift.
your gift.
Yes,
Sir,
sir.
thank you so much, sir. We got it.
पढ़ना भी है
I got two
पढ़ना
gifts,
भी
sir.
पढ़ लिया, sir.
है पढ़ना भी है
पढ़ लिया, sir. पढ़ लिया.
good. So the little few memories, few pictures, they'll bring us together
The
and
institution has become into a banyan tree now, you know.
with you around. You are the actually trunk of the tree, Shivani.
No, sir, I'm not.
Yeah, nobody without you.
It's a
So
big thing for me, so thank you so much.
uh, good. So it brings a lot of memories to my mind, and we are growing in terms of number. Very soon you'll find the new version of our academy, and this is pictures
Yeah.
around 3 years of age. Now we come to the newer version. It's become a bit more organized, like a pathshala. I never take off my scrubs 24/7 nowadays. It's like a pathshala now. I hope you're able to spot yourself somewhere. Any one of you, if you're able to spot yourself, say hello. And but very dear to me. All these pictures are very dear to me. A lot of friends we are making all over the world. We have trained more than now 600 gynecologists all over the world now in these courses. So these memories are very dear to my mind. And as we move on quickly. So as we are now progressing, we move to the new location. There's a new location now, which is slightly bigger, slightly bigger. Hi Aruna, how are you? Aruna is coming on 19th afternoon. Great. Trishala, how are you? So this is a new version of the place. Hi, and many of you will be able to find yourself smiling somewhere and laughing. We have a lot of fun. We're bringing out one of the biggest books in the world. It is the biggest book in the world, not one on IVF. In case you want to buy a book on IVF, hold on for one more month. That will be the masterpiece. And it's a big book. Just hold on. Don't buy any book. Curtain results. We had the last one on lab setup. This is our program, and we are going till now 18th of February. So these are few PRPs today: semen analysis, poor ovarian reserve, Poseidon criteria, PCOS, endometriosis 26, RPL. So this is our alumni grooming program where we make you people speak in front of the camera and do some Facebook lives with you. Any one of you wants to join, we have got now around 3.5 million views of the people who are there. This is our Facebook lives, and till 28th of January, we are very well placed. A lot of likes, people are getting 169.2K views. So you'll find that people are watching you, 159K views. These are all organic views. Nothing, it's not bot views. So people are watching you. So this is on the role of age, lifestyle factor. We just had this one, I think, a few days back. This is with the Shelly Gupta. Last one we had with Shelly. Shelly is here. With Jashri, with the next one. So on. We got these coming up. Do watch. 251 5-star reviews, 2200 videos.
Oigo, आवाज बंद कर कैसे
So do hi, how are you? So just
आवाज
watch the videos in case you want to watch. And the curtain raiser series courses we all know it's on IVA, IUI, and I've left it here. I'll bring it down. ICSI and
My name is Dr. Sonam Mittal.
so I'll just move quick a few glimpses and come make the whole process work. So go inside and take around learning how to stop.
Stop.
Done. Has the recorder on pick up?
क्यों दिखना चाहिए जिधर कट करना है
So
आपका
Smokey,
एंगल टुवर्ड दैट साइड रहेगा आपका
जैसे मान लीजिए
Arpita. I am here for the hand.
loading again. So I think I'll just move on quickly so that I don't waste your time. This is our package on the curtain razors. In case you want to purchase, you can purchase that. The courses are super hit. In case you want to learn 3D and beyond, you can always come over and learn. The next course is on 19th. These are few pictures of our organization with ultrasound batches and PRP and Alumni Connect program. So I want to tell you that we are having a big Alumni Connect program on 16th of November. It is on 4 sir. Don't miss it. Please don't miss it. It's only for alumni E1 to E22. Links will be reaching you. We have one on 23rd of November. It is on AI. I wanted to reach you people with AI, the newer things that's on AI on. So there are 2 ACPs, and now I'll like to actually start the class with the blessings of Lord Siddhi Vinayaka. And we have Dr. Suryakant. In case he has joined, he can say hello, but I'll be calling in around half an hour from now.
Hello.
Hi, sir. How are you?
Yes.
How are you? How are
Can you
you?
hear me, sir?
Yes, I'm humbled to have
Nice.
you in front of me.
Thank
So
you.
I'm gonna start from here. I'm gonna invite you around half an hour, sir.
Sure, sir.
You can find my mistakes. So this is the way we look at. I'm gonna focus not on dermatology, not on cosmetology, not on ortho. Hi, Menka. We are
Hello, sir. Good evening, sir.
Beta. So we're focusing on uterus, and this is what we are always looking for. Beautiful. Triple layer lining gives me a lot of happiness. And this is beautiful. What is this here? क्या चीज़ है?
Cervical mucus, sir.
Fantastic. What zone of blood flow?
Zone 3 and 4.
What type of color flow is this?
HD.
Zone 4, sir.
What type of color, guys? What type of color? Hash
Power
color.
Doppler.
Power
Power
dot. Who said
Power
that?
Doppler. Power
Who said
Doppler.
that?
Me, Anurag, sir.
क्या बात है अनुराग? Power Doppler. Power Doppler. And what is this? What type of flow
This
is
is
this?
color flow.
HD flow.
This is actually high definition flow, but what type of flow is
HD
this?
HD
What
live है.
4. Zone 4.
It
Zone
is,
4 and 3.
it is radiant flow. Radiant flow. It is radiant. So when endometrium becomes like this, we got some pockets occurring here. Goes towards having some sort of Asherman syndrome. There are some fluid pockets start coming here. So there are people who don't. You'll find some sort of fluid collection coming here. So there are the ones who don't respond to our therapy. Indradeep, hi.
Hello, sir.
I so
Good
this
evening.
is what we get. We get a thin ED, and that puts us skyrocketing. How to do about this case? This scares me quite a lot. And then this is a definition. Less than 7 is called thin ED. So trilaminar appearance can be there. Remember that there can be trilaminar appearance with thin ED. It can be, but overall the lining is less than 7 millimeter. It can be dangerous, and then it will lead problems for the embryo to implant. This is one part of our learning. The second part of our learning is when we get the ovary width. Small number. So there is something wrong. Maybe girl. Nowadays,
reserves.
अभी पता क्या हो गया? There is no difference between a young girl and a girl who's 43, 44. They all want their own little baby. Then why not? I am totally with them. But then the concept changes. With a girl of 33, I told you there are 2 cases. There are so many girls who come to me at 43, 44. They also want to have 70% outcome. They can't understand that their outcome will be 2%. They want 70% outcome as they get at age of 33, 34. And probably fault is ours because we are over promising everyone. So this is what we are looking for. What is this, guys? What do you see here?
Sono
Yeah.
ABC.
No. How can it be Sono ABC?
Vocal.
What is vocal? What is vocal?
वर्चुअल ऑर्गन
Virtual organ. Computerized
कंप्यूटराइज्ड
Analysis.
एनालिसिस
This is Indradeep's vocal.
This is Sono ABC. Yeah.
This is
So
Sono
this Sono ABC. This is very good, no? We're getting a lot of follicles here. So now just look at this now. आप सोचो कि like we have a ground net, no? We have a ground net. Just think that the ground net has got a lot of nuts in it. And all these nuts are little growth factors. So we have to break open the groundnut and all these things come out and then they help us heal the patient. So in case we look at we have got VGF, FGF, IGF, all these things are there. All are anti-inflammatory cytokines. When we have an injury, platelets, they heal us, no? They stop the bleeding, they heal the body. They help us in forming the clots. Stem cell recruitment. So all these things